Are we on time?
Yeah, we're a minute early, but I think we're good.
We're a minute early. Holy mackerel! Well, that gives me an opportunity to delay just slightly here. So we'll do that. It's unusual. People who will know our briefings. We're good. We're good. Good morning, everyone. It's great to be here for a truly exciting announcement, a historic announcement today. Before we begin, I want to recognize that we're on the traditional territory of the Squamish, the Musqueam, the Tsleil-Waututh First Nations, and we're honored to be here on their lands. Joining me to say a few words today is a good friend, the Mayor of Vancouver, His Worship Kennedy Stewart. I like to call him His Worship because I've known him for a while, and it's great to have Kennedy here. The Provincial Health Services Authority President and CEO, Benoit Morin, is here, and we have someone who knows from their family about the issues of children with complex care needs, Annie Kudian, who is here behind me, and it's wonderful to have you here today, Annie. We're here to talk today about complex care needs for children and young people in BC. Children with complex care often require many different supports that are often challenging for families and caregivers to provide from home. I just want to put it in context because we're here on the Sunny Hill site, and this is one of the most important places, one of the most remarkable places in British Columbia, and not, I think, a lot of people in British Columbia know about it because obviously there are many children with complex care needs, but they represent a tiny proportion of the overall population of children, and yet for decades and decades and decades, back to the 1930s, on this site, children have been provided with care. To put that care in context, about 8,000 children in BC with complex medical and physical needs have accessed BC Children's Hospital services in 2017 and 18. Of the total number of children with complex care needs who've accessed BC Children's Hospital, 20% live outside the Lower Mainland. And the number of children needing to access such care and families is expected to grow by 17% by 2035. So our government has viewed this as an opportunity to take action and show innovation to better address the care needs of these children. And it's why we're here today. I'm excited to announce that a BC Children's Complex Care Transition Centre is coming to Vancouver, and it's coming to Vancouver right here on Slocan Street at the current site of Sunny Hill Hospital. Our government has approved the concept plan for a first-of-its-kind children's complex care transition facility in BC and leading edge in Canada to provide much-needed services and support to young patients, their families, and care providers in communities across BC. That means better care is on the way for children with complex care needs, children with multiple and complex health issues around the province. This is an incredible opportunity to fill gaps in services for children with extraordinary needs requiring complex care. The BC Children's Complex Care Transition Centre will serve as a stepping stone between acute hospital care, community care, and home, making life easier and better for families and their children. We want to talk briefly, and as you know, the approval of the concept plan is the first stage in the approval of capital projects in BC. It means that the project is in the 10-year capital plan. It means the money is there for the project. And here at the centre, it will mean the new facility provides services under a unique model of care that is designed to support patients and families with the transition between acute hospital care and home. That addresses, in fact, the changing needs of children and their families. Services at the new facility will range from assessment, examination in children, and treatment for children and young people up to the age of 19 with complex care needs. The centre will also provide training and research and support for clinicians. Care will be provided by an interdisciplinary team of physicians, nurse practitioners, nurses, and allied health professionals. The centre will also provide training for parents and caregivers to help with care delivery at home, as well as support with siblings. Virtual care will also be expanded to provide access to services closer to home whenever possible. The aim is to support children to improve the quality of their lives and those of their families through building local care capacity, avoiding crisis requiring admission to an acute care facility, and providing a transitional facility for those moving from an acute care setting, moving from hospital, for those setting back to the community, but who are not quite ready for a full return. As for where it will be, of course, it's right here. It will be here at the current site of the Sunny Hill Health Center for Children. Of course, this means Sunny Hill is relocating, as all of you know, to the main campus of the BC Children's and Women's Hospitals shortly, in fact, in the weeks to come. I know this Sunny Hill Health Center for Children site is an important part of the community here on Slocan Street. The site has, as I said before, provided a long history of providing health care for children. It began serving Vancouver, can you believe it, in 1931, when it opened as a preventorium to treat children with tuberculosis. In 1935, it opens its doors to children with tuberculosis from across the province. In 1958, it was renovated and reopened as the Princess Margaret Village for Children. And in 1961, the facility evolved to become the Sunny Hill Health Center for Children that we know now, where children with disabilities and their families are supported with specialized rehabilitation services. I know that a while ago, there was an announcement of a relocation of the Sunny Hill Health Center to the BC Children's Hospital campus, and it raised, of course, questions about the future use of this site. This site has been dedicated to the health care of children with complex needs, and I believe it should continue to do so in the 21st century, that Vancouver needs to be, amongst all the other things it is, a center for children, and British Columbia has to be on the leading edge of care for children with complex care needs. That this is our obligation, especially to those children and to their families. And that's so why I'm so proud to share the good news that this site will be home to the BC Children's Complex Care Transition Center. With this concept plan approval, we now move on to the business plan phase, which finalizes project scope and budget. This normally takes 12 to 18 months. So this is indeed very big news. It means that the future of this site is assured into the future, that this site will be dedicated, as it has been since 1931, to the care for children. We've identified and filled a gap in the public healthcare system and are moving to fill it. I want to thank everyone who's worked behind the scenes to get us where we are today. This includes the team at the Provincial Health Services Authority. It includes a broader team of specialists who've worked on this project, and it means the community as well. As people will know, the community around the Sunny Hill facility loves this place, believes in this place, has volunteered in this place, has offered their homes to parents whose children have got care in this place. It is loved in this community. And the fact is that we have, I think, an obligation to the future that is supported by the community overwhelmingly in our community consultation to continue to provide healthcare services for people. We believe the community is a key aspect of that. That's why we're putting together a community advisory group that will be in regular contact with the project team. They will help shape the framework for the community engagement. I'm proud that we are working with our neighbors as we work to building a world-class center for children. Our government is committed to helping children and families across the province lead the healthiest and fullest lives. And today's announcement of the new Complex Care Transition Center will help build stronger families and more inclusive communities. And that, I think, is an exciting thing to do on a Monday morning. We are living in a time of significant healthcare challenges where the fact we have a public healthcare system that provides care to everyone is of such value. It is a singular value for Canadians. Obviously, some people face greater challenges than just the average person, but we're living in a time when public health care is showing its worth to people in this city and in every community across British Columbia, just as this place will serve this city and every community across British Columbia. It is my honor now to introduce Mayor Stewart, and if I want to say something about Mayor Stewart and his commitment to people in the community and his support during what's been an extraordinary period, this period of pandemic. This was especially true in March and April when Mayor Stewart stepped up and showed enormous leadership and commitment to the people living here, supported our efforts to address an unprecedented moment in the history of the city and in this province. I'm very appreciative of that. Mayor Stewart's commitment to people in the city is well known, but I think that he has demonstrated this year the importance and the value of that commitment to the health of people living here, their basic well-being, and their understanding of what it means to be part of a community. So it's my honor to introduce Mayor Kennedy Stewart.
Good morning, everyone, and thanks very much for that introduction, Minister Dix, Adrian, if you will. We have been friends for a very long time, and it's a great pleasure to be here today to participate in this, I think, very historic announcement. Before I continue, I too would like to thank the Musqueam, Squamish, and Tsleil-Waututh for hosting us here on their unceded traditional territories, and I want to thank them for taking care of these lands for countless generations. And I'm so proud about how the city and the First Nations are working together to move this great city forward. I'd also like to take a moment to recognize the hard work of Minister Dix, his team at the Ministry of Health, and the entire BC government, and what they've done and continue to do leading our province through COVID-19. And normally I think we'd have a round of applause. I think we all feel that here in the province, but it's a bit strange doing it myself, but I will say thank you very much to the province and Minister for all their work. I particularly want to thank and personally thank Minister Dix for his guidance through the early stage of this pandemic, where we had daily calls discussing how the city and the province would work together to keep all of us safe. And I think to this point, we've had very good success. It's acknowledged right across the country and, in fact, around the world, the work that Minister Dix and Dr. Bonnie Henry and all the medical teams have done to keep us safe, but there still is a lot of work to do. So we're going to have to renew our vigilance, and that's where I'm wearing a TransLink mask today, because today is the first day that we're all required to wear masks when we're on transit. The pandemic has uncovered the stress points we've had in our public services and institutions, but we are fortunate to have a provincial government that is focused on reinvesting in these services and institutions. And that's why we're here today to celebrate and further our investments in our healthcare system, specifically for our children. East Vancouver has a long legacy of providing children's healthcare services, and this site has always been a point of pride for the community. That's why I'm pleased to see this 90-year legacy carried forward with a new BC Children's Care Transition Centre right on the spot. This first of its kind in Canada facility is located right here in East Vancouver, but will help serve families from across British Columbia. And what better place than here to welcome these families? Surrounded by green space and a warm, welcoming neighborhood, this new facility will provide the perfect setting for children and their families as they transition away from acute hospital care and into home care. So on behalf of City Council, I know we all look forward to working with the PHSA and the Ministry of Health to help keep children's healthcare services right here in East Vancouver. So thanks very much for your time today. Thank you again, Minister. And I'd like to now turn the podium over to Benoit Morin, the President and CEO of the Provincial Health Services Authority.
Good morning. It is wonderful to be here today for this great announcement, if not historical announcement, and I feel privileged to be joining Minister Dix, Mayor Stewart, and Mrs. Goudian for this announcement, which is made on the Coast Salish Nation unceded territory. As was mentioned by Minister Dix, the expected move of the Sunnyhill current services creates an opportunity for the Slocan site to be used to offer unique and innovative services for children with disabilities and care complexity. These services are cutting edge in their design and at the forefront of best practices in the world for children's services. This is a step up and step down approach that will also aim at reducing future hospital needs. PHSA staff and physicians will work in collaboration with patients and their families to ensure a smooth transition from acute care to home and community care. The new BC Children's Complex Care Transition Centre will also foster partnership between research, education, clinical services, patients and families to enable innovation and the development of best practices. I would be remiss not to stress the efforts invested in making this new, innovative facility welcoming to all. As part of that commitment, Indigenous cultural safety is an important element of the planning and design. As you can see, this is a very special announcement of a new kind of services that will benefit children and families in every community across British Columbia. We owe this announcement to the incredible collective effort of many stakeholders and partners, including clinicians, government officials, and specialized staff. Thank you to all involved. We also owe today's announcement to Minister Dix and the provincial government for their vision and committed support in making a dream become a reality. For so many children and their families, this is what's happening today. I also extend my thanks to Mayor Stewart and the City of Vancouver for their support and for their continued great partnership. PHSA looks forward to working with all partners and stakeholders to turn this vision into reality. I will stop here and invite Mrs. Goudian to say a few words. Thank you very much.
Good morning. My name is Annie, and I am a mother of a child with special needs who is bound to a wheelchair and requires one-on-one support in all aspects of his life, 24 hours a day, 7 days a week. My son Anthony had an in utero stroke, and we as a family were told by healthcare professionals that he would have global developmental delays and would not survive to see his second birthday. Anthony is 14 and a half years old now. My son lost the ability to chew, eat, swallow orally at 16 months of age. Hence, he required feeding tube to deliver necessary daily medication and nutritional needs. At discharge, many years ago, I was very ill prepared to care for my son at home and pleaded with his doctors to please connect me with the right resources to teach and help me and my husband how to take care of our son. I found the experience of caring for a child with lifelong complex needs extremely overwhelming and the experience very isolating. 2 years ago, when he was 12 and a half years old, Anthony had spinal correction surgery and 2 stainless steel rods were inserted into his spine to correct the 110 curvature. His body looked like the letter S. Again, I pleaded with my son's healthcare professionals after surgery in guiding me to find the correct resources to learn to take care of him properly at home without having him incur any further pain and injury. Unfortunately, no such service was available. A complex care transition center would have been invaluable for me, Anthony's primary caregiver, and our family to support and prepare our journey through recovery at home. There was no one to help understand and keep track of all the information that we were being given by Anthony's doctors and therapists while we were going through experiencing the new normal of our son's daily life. As I became a nurse and a doctor without a degree overnight, right after Anthony was born, I had to quickly learn an entirely new set of technical medical skills in order to take care of him, while processing that he required a high level of support throughout his life in a world not designed for him. My family and I welcome the announcement about a new Children's Complex Care Transition Center, and I wish that I had the opportunity to spend longer training on home care procedures and access to counseling and peer supports to help navigate what was required to care for Anthony throughout the years. This would have added extra strength and confidence, knowing that there was an entire team giving us the necessary tools to succeed. As I struggled to become the mother, doctor, nurse, therapist, and caregiver that my son needed, I thought about how so many families would not have the strength and ability to care and protect their children. The Complex Care Transition Center would not only be an amazing resource, but also invaluable for BC families to learn to help their children with complex medical needs live the best quality of life possible. Thank you.
Thank you very much, Annie. I'm going to turn it over to Shruti Joshi to take questions people may have over the phone.
Thank you, Minister. But before we take questions, a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this morning. And please do not mute your phones. You will not be heard until I call your name. We begin today with Marcella Bernardo, News 1130. Marcella, go ahead, please.
Hi, Marcella.
Hi there. Hi, Minister Dix and Mayor Stewart. I actually have questions that don't have anything to do with Sunny Hills. I was hoping I could maybe come back to you after, or is it okay to ask that now?
Just ask away, Marcella. Ask away. This is an interesting time. I can't tell you what an exciting day this is. So.
I know, and I think I have everything I need about the actual announcement, but I was hoping to ask you about concerns that are still being raised from people about the need for mandatory masks from parents and education concerns, and whether or not that's being reconsidered now as we see case numbers spike.
Well, thanks, Marcella. I mean, and as you know, Dr. Henry and I will be back and giving a briefing later today on the COVID-19 situation in British Columbia at 3 o'clock. We're seeing a number of agencies move to just that. Mayor Stewart mentioned today, and this is part of his leadership there, that TransLink is moving to mandatory masks as of today. So we remind people to bring their mask if they're going to ride on a bus or ride on the SkyTrain today. Equally in hallways at school, that the school plan that's being developed with our many partners includes that provision, and in fact many businesses, especially businesses that have small spaces and where physical distancing can't be maintained, are doing just that. So there's no question, and if people want to know what I do when I go into a business, I'm wearing a mask. When I went grocery shopping yesterday at Save On, I wore a mask, and will continue to do so. So I think we want to encourage people to do so, but we also want to understand what we need to do to limit the transmission of COVID-19. And a mask is important, but as Dr. Henry, I think, has said many times, is at the bottom end of sort of the scale of importance of things that can limit the spread of COVID-19. On the top of that are things such as physical distancing, which is critically important. Rules that limit the size of gatherings, critically important. Environmental restraints, such as, for example, in a most average way, the use of plexiglass in many places, which stop the spread of COVID-19. I think there's a tendency amongst people to want to search for a one bullet, a silver bullet that we can easily do and then not have to do all the other things. The reality is we have to do all of these things, as well as the extensive contact tracing, the extensive work being done by public health with people to ensure that we don't see further transmission of COVID-19. And I think the actions that were taken by the government in concert with municipalities such as the City of Vancouver to ensure that especially the rules around gatherings are maintained in the province are important steps as well. So it's not one thing, it's many things, and there's definitely a role for masks to play in that. Dr. Henry has said that from the beginning. I've said that from the beginning, and we continue to say that. And we don't just say it, we act it out in our daily lives.
Thank you. And Marcella, before I take a follow-up from you, I'd like to remind the media on the phone to please press *1 to line up for questions. Marcella, go ahead if you have a follow-up.
I do. It's for Mayor Kennedy Stewart, if he's able to take any questions right now.
Welcome up here.
Mayor, we saw over the weekend an incident in which a young man had his leg broken by some men that are accused of spreading hate crime in the West End. And just what, if any, action is the city going to be taking to crack down on these people that are accused of spewing hate crime with loudspeakers in the West End?
I've been, of course, of all of us have been following this story very closely. Hate has no place in our city, and I'm glad and commend the VPD for apprehending 2 suspects that have been charged with aggravated assault. That's my understanding. So the VPD acted quickly, and I know that hate crime charges are being looked into at the moment. I have the absolute confidence in the VPD that they're going to handle this correctly, and I really wish the victim in this this ordeal a very speedy recovery, and thank him for defending the West End and that community. Hate has no place in our city, and the preachings of these folks are absolutely despicable and have no place in our city.
Thank you. Seeing no other questions in the lineup, we will conclude this event this morning. Thank you all for participating.